Hello, and welcome back to another Sunday Funday broadcast with your host, Letitia, and special guest, Stacy. Hello, Stacy.
Germs.
Have a seat.
Thanks.
So this is Stacy. Stacy, tell everyone how old you are.
I am 23 years old.
Okay, now do you have any special hobbies or anything?
Well, I do collect things. A lot of people say it's hoarding, but it's collecting.
Okay, now, what do you collect the most?
Stuffed animals and bobby pins.
Do you do anything with these things, or you just have them?
No, I just have
They
them.
just sit there?
Yeah.
Okay, well, I do know that you have something about you you'd like to tell us.
I have OCD.
Okay, now do you mind if I ask you a couple of questions about this disorder?
Not at all.
All right. Well, my first question would be how does OCD affect you?
Well, not only me, but the other patients that suffer with OCD often have a very poor quality of life because the condition rules most of the day. Mm-hmm. But with my OCD, I realize that obsessions aren't reasonable, and I try to ignore them or stop them. Unfortunately, this effort tends to only increase my distress and anxiety.
Okay.
Ultimately, that I feel driven to perform compulsive acts in an effort to ease my distress. Mm-hmm. Despite my efforts, the distressing symptoms of obsessive compulsive disorder, OCD, keep coming back.
All right. Now, my next question would be how does this progress?
Luckily for OCD patients, it doesn't usually progress into another mental health problem. However, when I first was diagnosed with OCD, I couldn't sit still and I couldn't shake other people's hands because of germs of what you saw before. Sorry about that. You know, the counting in my head kind of thing. But now I find myself going back and forth, making sure, you know, I close the refrigerator door 10 times and I shut the light off, 7 times. It's just I have to keep going back to it kind of thing.
Okay, I see what you mean. My next question would probably be what kind of, diagnosis do you have for it? Like therapeutic or like medically?
Well, there's both for people with OCD, luckily. But the most effective treatments for OCD are the cognitive behavior therapy, or CBT, and medication. Most specifically, the most effective treatments are a type of CBT called exposure and response prevention, ERP, which has the strongest evidence supporting its use in the treatment of OCD, and a class of medications called serotonin reuptake inhibitors, or SRIs.
All right, now, what does that all mean?
Well, exposure and response prevention is typically done by a psychologist or a social worker or a mental health counselor. And with your visit to your therapist's office at a set appointment time once or a few times a week. And cognitive therapy is based on the idea that certain ways of thinking can trigger or fuel certain mental health problems such as OCD. But the therapist helps you to understand your current thought patterns, like in particular to identify any harmful, unhelpful, and false ideas or thoughts which you do have, and also to help your thought patterns to be more realistic and helpful. Like, for example, if you do have OCD, like me, it may be helpful to understand that thoughts or obsessions in themselves do no harm, and you do not have to counter with the compulsive acts.
All right. Well, that was great. Thank you for that. I do have your psychologist on the line.
Dr. Ann Charlie.
Yes.
Okay, perfect.
She couldn't make it here today, but she said she would agree to like a conference call kind of thing.
Yes, absolutely.
All right. So let's go to her.
Yes, thank you for having me.
You're welcome. Hello, Dr. Anna Trolley.
This is she. Hi, how are you?
Good, how are you?
Good.
Okay, well, I do have your patient on the phone as well with me,
Yes.
Stacy.
Yes.
So is it okay if I ask a couple of questions?
Absolutely. Ask away.
All right. The first question is, how does the medicine help and harm a person by taking it?
Well, 7 out of 10 people with OCD will benefit from either medication or exposure and response prevention. However, for the people who benefit from the medication, they usually see the OCD symptoms reduced by 40 to 60%. For medications to work, they must be taken regularly and as directed by the doctor. I recommend serotonin reuptake inhibitor, SRI, which is traditionally used as an antidepressant, but also to address OCD symptoms. It lowers anxiety and depression. However, SRI shouldn't be combined with other medications due to the high blood pressure.
All right. Now, why do some people choose not to take medication after a period of time?
Well, about half of OCD patients do stop taking the medication due to the side effects or for any other reasons. You can experience side effects and you should bring this up with your doctor so they can help you address them and they may be able to change your dose or find a different type of SRI that system would be better to tolerate.
All right. Now, my last question is, how is society affected by OCD?
Good question. While many patients lead apparently normal lives despite OCD, it often takes a toll on the individual and on the family. In many cases, OCD significantly encroaches upon ability to function productively in society, in the social, family, work, and school settings. It's expensive. It's a costly thing. The financial cost of OCD to the U.S. economy is estimated in excess of $8 billion per year.
Okay, well, that's all my questions. Thank you for being on the show.
Absolutely. Thank you for having me. Sorry I couldn't be there.
That's totally fine, no problem. All right, have a good day.
You too. Bye-bye.
Bye.
Crazy funky junkie on the side, hand slightly. Decline, why did you do this to us? Well,
this is just such an emotional broadcast.